Since January, News 4 Investigates has been reporting on issues and solutions surrounding the mental health care system in this region. The growing need for more treatment options is sparking new approaches to a very complex system.
And that includes shifting the mental health care model from hospitals to respite and recovery when appropriate. Luke Moretti reports.
Meet Shannon Higby,
just this week, as we were doing our community walkthroughs for the site.
CEO of Recovery Options Made Easy.
A gentleman from the community said, sometimes someone just needs somewhere to go, someone to talk to, a space to feel safe.
And that space is right here on Maple Street in Buffalo's Fruit Belt community. Welcome to the Kirsten Vincent Respite and Recovery Center, dedicated in memory of the center's former CEO, a leader and innovator in the field of mental health.
Really, this was envisioned close to 5 years ago by our former CEO, Dr. Kirsten Vincent, who unfortunately did unexpectedly pass away in May of 2021, just after we had identified this as really the ideal location.
It's the latest collaborative effort to help ease the need for more mental health care options.
We're really starting to just see the fruits of all of that labor, all of that planning.
And as pieces come online, advocates hope to reduce the number of individuals falling through the cracks. Shannon Higby says it will require a lot of community education.
Even now, for lay people, it's still a difficult navigation piece, and that's why it's so important for us to have opportunities to talk about services and service delivery.
She sees a refocus on mental health, not just locally, but nationally. The Respite and Recovery Center offers 4 distinct programs under one roof. First, there are 2 levels of peer-run respite programs.
Those individuals do not need a particular referral. They just need to be 18 years and over and self-identify that they're experiencing a mental health crisis.
It's all voluntary in a come-and-go atmosphere where a person can receive support and still meet their obligations out in the community. Different than institutional care, this setting is flexible and allows people to maintain their connection to the home front.
They may have recently gotten employment and then, ultimately lost it because of that inpatient stay. Having the opportunity to still go to a job if they need to, but receive that support in the off hours to identify what their crisis needs are and to link them to the appropriate services.
Recovery Options Made Easy runs a short-term and intensive crisis respite program. They operate 24/7. But in addition to that, there are partnerships like Spectrum Health and Human Services, which Higby says will offer clinical engagement services under the same roof.
So if someone comes in, they're not already engaged with services elsewhere, but they want to be engaged in some level of clinical support, it's right across the hall.
And there's the Renewal Center, a living room model approach to mental health care, operating from 3 p.m. to 11 p.m. 7 days a week.
They're able to receive peer support. They have peer support for their hours of operation.
Earlier this year,
it's comfortable, it's personable.
We sat down with Kevin Smith, the director of Mental Health Peer Connection, to talk about the living room model.
We'll help you in the moment. You can leave whenever you want. We don't force you to do anything.
Not everyone struggling with mental health issues needs hospitalization. Sometimes a good listener, a change of environment, a place where you can come and go freely could make a difference.
That's ultimately the goal, is to keep people independent in the community and have the dignity of services that represent their needs while acknowledging that they have lives outside of their mental health crisis.
Shannon Higby says these are all voluntary services designed to be delivered in home-like community settings. It's an innovative approach to a growing need for more mental health care options. Luke Moretti, News 4.